you might not even need to implant anything, and you would need just a What's going on, guys? Rolandas here. Today I'm gonna be analyzing one case of one of my subscribers. If you recall, I asked you guys on my YouTube community tab as well as my Instagram to share your pictures with me alongside other little details if you want to have my assessment on what you could possibly do with your hair loss in terms of hair loss medications, hair transplants, how many grafts, etc. And this is gonna be one of those cases. And if you haven't noticed it, check out my Instagram for all the details and send me your pictures, and maybe I'll be covering it one of the future videos. If you want to see more videos just like this one in the future, make sure to subscribe to the channel. And let's go. These are the pictures that this guy sent me over, and it looks like, to me, in my opinion, it's something about Norwood 3 with the receding hairline, obviously, but the mid part central forelock is not really that strong as well. Yeah, as we can see here from the front, it definitely drastically thin out, and it's basically the whole front is going away. It's really actually reminds me of my case when I started progressing. And yeah, but in this case, it definitely is an A. And the donor area at the back. So the crown, it looks like there might be something, but this might be as well just a simple whorl. So I would like to see some other pictures. And we don't have any more pictures showing directly the crown, the whorl. But from these ones, from the top angle, it doesn't look like it's going much, if any. So I'll go ahead and assume it's about Norwood 3A, which means he's basically receding in the frontal third. It looks like his temple peaks started to slowly recede as well, but they're really strong still. It's a little bit thinner than over here, but this of course might be as well just due to like a picture quality and the light condition as well. But I would not see the need to to do anything, basically, if you're talking about transplant. So right off the bat, let's talk about the medication. Of course, I'm not a doctor, it's just my opinion and my observation, dealing basically from a lot of people and personally as well. So in my opinion, you would need to start looking into Finasteride to stop further progression of baldness from miniaturization as well. And also look maybe even potentially into minoxidil, because there's quite a few hairs, especially in the central forelock, that could potentially thicken up quite drastically, to the point that you would need less grafts, during the transplant. So the idea of the medication is to stop further progression of hair loss and also to strengthen as many hairs as possible, because we all have limited amount of hairs in our donor area for the transplantation during our whole life. So it's a smart idea to preserve as much of native hairs as possible. So definitely great idea to find a doctor who can prescribe Finasteride, whether it's offline or online. And also minoxidil is widely available, pretty much everywhere. I know I mentioned you're living in the UK, so in the UK it's widely available in places like, basically in pharmacy, even like pharmacies like Boots, etc. I seriously doubt you're gonna regrow your hairline to the point you're happy. You still will likely need a transplant, but it's always a great idea to see how well you're gonna respond, because some people, they're absolutely hyper responders, that they grow so much hair, it's pretty mind-blowing. But the best practice, according to many hair transplant surgeons that I talked with, they're suggesting to start Finasteride and be on it for at least 6 months before your hair transplant surgery. So I would eyeball all of this area in the front, would drastically thicken up to the point that you might not even need to implant anything, or very few grafts in this like a central part of the forelock basically, and you would need just 1,500 or so grafts just to kind of close these temples. That's it. By the looks of it, your androgenetic alopecia is not severe, at least right now. You just said that your father and grandfather both suffered from hair loss, but to what degree, it's actually very important. But it doesn't look like you're going to Norwood 6 or 7, which is a good thing. And if, let's say, we look at your family history and there is nobody that is like Norwood 5 to 7, like Norwood 4, Norwood 3, etc., I would be quite, optimistic to go into like a lower little bit hairline, to be honest, with a hair transplant. Maybe something like, starting from this point and like that. So it will not be 100% straight, but you don't need to, for it to be straight. And to be honest, you're gonna look pretty decent. It's not a big amount of grafts would require. You're gonna structure your hairline really nicely, and also if you start minoxidil and Finasteride, I would expect your temple peaks over here to kind of thicken up a little bit to the point it would have a bit more structure. So you would look something similar like this, and you would be really nice structured hairline, basically framed to the face. And from the front, I would eyeball again something like this. Very roughly. It's not gonna be super low, but it doesn't have to be super low to in order to look great. And again, if for example minoxidil finasteride would give great boost to this area, I would think that this area would need very minimum amount of grafts, if any, to be honest. So yeah, like I said, up to 2000 even grafts, if medications work well, you could get away with. And looking at the donor, it looks pretty good. Of course, the hair is a little bit longer, like a bit too long to be honest, to assess it properly and well. But it doesn't look like you got any thinning, it doesn't look like you got any retrograde alopecia in there. Again, the pictures are not super clear, but it doesn't look like there is any thinning around the ears. Here, just a tiny bit thinner, but again, it might be just the light condition, the way hair styled and etc. So overall, I would say it looks pretty decent. And if you're talking about FUE, it definitely could yield like 5000 grafts, I would say. Again, this is just my very rough estimate, just from my experience that I've seen, but of course you would need to actually closely look into it, possibly trim your hair to lower and see how many grafts per centimeter square there are in order to determine basically your full donor viability. If this part of the crown is indeed confirmed thinning, then again, it doesn't look like it's much, and it's very likely that due to finasteride and minoxidil, you would be able to avoid completely a hair transplant in this area, because medications actually work the best in this area, in the crown. That would be definitely a great thing to try for 6 months before even committing for a hair transplant. But if let's say medication will not improve the area, but just basically slow down or stop completely your hair loss, then again, it's difficult to assess from this picture, but it would require very minimum work, like a few hundred grafts maybe at best, again according to this picture. You also mentioned that you already scheduled actually your hair transplant with one of the clinics that I'm not going to be mentioning in this video, and you are actually worried that there might be a possibility of a bad result because you've seen recently one. You have to get in terms with the fact that no hair transplant is perfect, and even at the best hands something can go wrong. So there are basically no guarantees in hair transplant, and an individual planning to get one should always consider like a plan B. What would you do if your hair transplant will fail? Because going to like a top quality surgeon doesn't necessarily mean you will be guaranteed successful outcome, like 100% survival, etc., which is actually impossible. And I've seen plenty of examples like that from even doctors like Dr. Bisanka, who is at the top level in the hair transplant industry. So the question for you is, what is your plan B? Do you have an extra money to spend in case you're not gonna have adequate growth? For example, if some of the areas gonna be looking thinner than you would like them to be. Very few amount of people will be 100% happy with their result after just one transplant, and most of the people would like to have just a tiny bit density. Maybe they would like to lower the hairline a little bit more, or more add density in the mid scalp, and maybe even like add some density in the temple peaks like I did on my second transplant. So there's a lot of variables, and it's very likely you will have your second transplant anyways at some point in the future. So it's a good idea to keep this in the back of your head. The place that you schedule with, I know them, I've seen quite a lot of results, and I think in their price bracket they're pretty much the best that you can find. Again, from just my opinion. So you said you schedule your surgery for June, so I would strongly advise to see a doctor and get a prescription for finasteride. You also asked me whether you should start with 0.5 milligram or go directly to 1 milligram, alternative days, etc. Usually it's 1 milligram per day, but in my personal opinion, and this is how I started slowly. I started with 0.25 milligram actually 2 times a week, and slowly build my dose up. How you're gonna do it is up to you. Speak to your doctor and talk about it. Another thing you asked me about aftercare, regarding sunlight, wearing a hat, etc. All of these answers you should really receive from your clinic, and different clinics can have different opinions on this, but as a general rule of thumb, you can wear a hat from even day 5, because at this stage the grafts are fully secured. It's really impossible to dislodge or pick them out, but you have to still be careful when you're putting your hat on and off. And in terms of sunlight, you definitely should stay away from direct sun for basically as long as possible, roughly for the first couple of months, or until you notice that your redness pretty much completely disappeared, because if you go to direct sun when it's very red on your scalp, on the recipient area, you're gonna risk to keep this this redness permanently, which is not a great look. And the last question you ask me is whether having a dandruff will affect the transplant. If it's just a normal regular dandruff, most likely not, but if it's something really severe, almost like a seborrheic dermatitis, then you definitely have to treat this before. So if you have something really severe, go to a dermatologist and get a proper prescription, medication to get this in check. But if it's just a normal dandruff, you should be fine. It's a good idea to always keep your dandruff, in check with appropriate shampoos like a nice roll or any other ketoconazole shampoos. And for some people, actually, even the basic Head and Shoulders anti-dandruff works extremely well. I would personally suggest to try nice roll and basically check the box for the, directions how to use it. It's usually for the first, couple of weeks, it's 3-4 times a week, and then you're gonna be using it only once or twice maximum a week. And for the most people, this basic dandruff should go away in the first basically 2 weeks. So that will do for me, and I hope I answered all of your questions. And by the way, if any of you guys wants to receive some similar, my analysis on your case, you still can send me your pictures with all the details about your family history, etc. Check out my community tab on YouTube or my latest Instagram post where I discuss basically everything I need from you in order to make this video. And for now, thanks so much for watching. Subscribe to the channel for more videos just like this one. I'll see you in the next one. Peace out.